As is the case every year, pink is everywhere. October is National Breast Cancer Awareness Month. 1 in 8 women, 1 in 8, will be diagnosed in her lifetime. But did you know that men can get breast cancer too? Now, this isn't a large population. Less than 1% of all breast cancers are found in men. Still, the American Cancer Society estimates about 2,800 new cases of invasive breast cancer will be diagnosed in men this year alone. Beyonce's father, Matthew Knowles, was diagnosed with male breast cancer in July of 2019 at the age of 67. He noticed blood on his shirt and his bed sheets, and he went to see his doctor. He underwent surgery that year. He's now cancer-free, but he carries the BRCA2 gene mutation. You've heard of this. It means he was genetically predisposed to breast cancer. Let's bring in NewsNation medical contributor Dr. Dave Montgomery to talk a little bit more about why awareness is so important. Dr. Dave, good morning to you. My first experience with men and breast cancer came from a mentor of mine, my choir director, Mr. Jackson. He sadly died of breast cancer before he was 60, complicated by diabetes. I know it's still rare, but do you believe we should add breast cancer screenings to men's regular screenings like prostate exams?
Yeah. Good morning to you. Really important topic. I will tell you, this is not on men's radar when it comes to cancer, and it should be. It's not on some physicians' radar when it comes to cancer, and it should be. You put up the statistic, 2,800 men this year in the United States alone will be diagnosed with breast cancer. Here's the other part of that. About 500 of them will die, like your mentor. And we should be thinking about this in a way that we're not. In other words, breast cancer in men is associated with some of the same things that it's associated with in women, but particularly first-degree relatives. Men are not necessarily thinking of implications for themselves when a mother or a sister develops breast cancer, but they certainly should be. While the numbers are low, Adrienne, it's not trivial, right? It's not trivial.
No, and so if a man's mother does have that BRCA gene, is there enough of a reason for him to actually be considered high risk, and should he get checked out?
Yeah, so really important point. My hope is that women who are diagnosed with breast cancer undergo the genetic testing. And if women are known to have one of the BRCA genes, we talk about these genes, BRCA, these are genes that increase your susceptibility to breast cancer in women and in men. And so if your first degree relative has a BRCA type 1 or 2 gene variant, the men in that family should be talking to their doctors about screening, because the screening recommendations are different. We may not ask every man to go screen because it's rare, but we should be asking men who have first degree relatives with the BRCA gene to see their doctors to ask about screening.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.